The first time I saw it happen, I thought it was a mistake. A 78-year-old patient with mild dementia, let's call him Robert, had been stable for months. His family had learned to manage his memory lapses, his routines were set, and he was even regaining some independence. Then, after a single doctor's visit for insomnia, everything changed. Within weeks, Robert was confused all day. He couldn't follow simple instructions. His personality shifted, agitated, then withdrawn. His family assumed his dementia had suddenly progressed. But when I reviewed his new prescription, I found the real cause, a medication that had accelerated his cognitive decline in a matter of days. And Robert isn't alone. Every year, thousands of dementia patients are prescribed drugs that make their symptoms worse, sometimes irreversibly. Today, I'm going to show you the 6 most common medications that can rapidly worsen dementia, ranked from the quietly overlooked to the most dangerous of all. If someone you love is living with dementia, what you learn in the next 10 minutes could change their quality of life forever. Let's start with number 6, a drug so common you probably have it in your home right now. It's called diphenhydramine, better known as Benadryl. That little pink pill people reach for to sleep, to calm allergies, or to take the edge off a cold. It's cheap, it's over the counter, and most people assume that because it doesn't require a prescription, it must be harmless. But for someone with dementia, Benadryl can be a cognitive disaster. Here's why. Benadryl belongs to a class of drugs called anticholinergics. These medications block a chemical called acetylcholine, the same messenger that dementia already destroys. In a healthy brain, acetylcholine helps with memory, attention, and alertness. In a brain with dementia, it's already in short supply. So when Benadryl blocks what's left, the effect is like pouring gasoline on a fire. The hippocampus, the memory center of the brain, takes the biggest hit. A 2023 study in the Journal of Alzheimer's Disease found that dementia patients taking anticholinergics like Benadryl experienced faster cognitive decline and increased agitation compared to those who avoided them. And here's the kicker. Many dementia patients are given Benadryl to calm them down at night, but instead of helping, it often makes their confusion worse. If someone with dementia is taking Benadryl for sleep or allergies, stop it immediately. Safer alternatives like melatonin or loratadine, Claritin, don't cross into the brain the same way and won't worsen cognitive symptoms. Number 5 is a drug prescribed for a problem most people don't like to talk about, overactive bladder. The medication is oxybutynin, ditropan. It's given to seniors who deal with sudden, urgent bathroom trips, the kind that can disrupt sleep and daily routines. For someone with dementia, oxybutynin can be a double-edged sword. On one hand, it reduces bathroom urgency. On the other, it blocks acetylcholine, the same chemical dementia already depletes. A 2020 study in neurology found that dementia patients taking oxybutynin had worse memory performance and increased confusion within just a few weeks. The drug doesn't just make dementia symptoms worse, it can also cause hallucinations and delirium, especially in older adults. If someone with dementia is taking oxybutynin, it's time to talk to their doctor. Newer alternatives like mirabegron work through a different pathway and don't block acetylcholine. For most dementia patients, they provide the same bladder control without the cognitive cost. Number 4 is a drug that's often prescribed to calm agitation in dementia patients, but it can do the exact opposite. It's called quetiapine, Seroquel, an antipsychotic. These medications were originally developed for schizophrenia and bipolar disorder, but today, they're frequently given to dementia patients to manage behavioral symptoms like aggression or restlessness. The problem? Antipsychotics like quetiapine can worsen dementia symptoms in devastating ways. A 2022 study in the Lancet Neurology found that dementia patients taking antipsychotics had faster cognitive decline, increased risk of stroke, and higher mortality rates compared to those who didn't take them. The drugs suppress dopamine, a chemical involved in focus, motivation, and memory. In a brain already struggling with dementia, this can lead to apathy, emotional flatness, and even more confusion. The FDA has issued a black box warning, the strongest possible caution, about the risks of antipsychotics in dementia patients. If someone with dementia is taking quetiapine or a similar drug, it's critical to ask their doctor, is this truly necessary? Many behavioral symptoms can be managed without medication through routines, reduced stimulation, and better sleep hygiene. When medication is needed, The lowest dose for the shortest time reduces harm. Number 3 is a drug that's often prescribed to help dementia patients sleep, but it can make their confusion worse. It's called zolpidem, Ambien. Sleep problems are common in dementia, and Ambien is frequently given to help patients rest. But here's the catch. Ambien doesn't just help people sleep, it alters brain chemistry in ways that can worsen dementia symptoms. A 2021 study in JAMA Psychiatry found that dementia patients taking Ambien had increased nighttime confusion, higher fall risk, and worse daytime cognitive function compared to those who didn't take it. The drug can also cause paradoxical reactions, meaning it can make agitation and aggression worse instead of better. For dementia patients, safer alternatives like melatonin or low-dose trazodone can help with sleep without the cognitive side effects. If someone with dementia is taking Ambien, it's time to talk to their doctor about switching. Number 2 is a drug that's often prescribed to help dementia patients with depression, but it can make their memory worse. It's called paroxetine, Paxil, an SSRI antidepressant. On the surface, it seems like a gentle, modern option, but here's the detail almost no one discusses. Paroxetine is the only SSRI with strong anticholinergic activity. That means it blocks acetylcholine, the same chemical dementia already destroys. A 2021 review in Frontiers in Psychiatry found that dementia patients taking paroxetine had measurable declines in memory and attention within just a few months. The drug doesn't just fail to help, it can accelerate cognitive decline. The American Geriatric Society lists paroxetine as potentially inappropriate for older adults, especially those with dementia. If someone with dementia is taking Paxil, talk to their doctor about switching to a safer antidepressant like sertraline, Zoloft, or escitalopram, Lexapro, which don't have the same cognitive risks. And now, number 1, the most dangerous medication for dementia patients. It's not a single drug. It's the combination of multiple anticholinergic medications. Imagine a dementia patient taking Benadryl for sleep, oxybutynin for bladder control, and amitriptyline for nerve pain. Individually, each drug may cause only small, barely noticeable effects. But together, they create a perfect storm of cognitive decline. A 2022 study in Alzheimer's and dementia tracked over 10,000 dementia patients. Those taking 2 or more anticholinergic drugs had faster cognitive decline, increased hospitalizations, and higher mortality rates compared to those taking none. The reason? Anticholinergics block acetylcholine from multiple directions, starving the brain of a chemical it already lacks. The result? Worsening memory, increased confusion, and even delirium. The good news? This decline is often reversible if caught early. The solution is simple: a medication review. Sit down with the patient's doctor or pharmacist and go through every prescription, over-the-counter product, and supplement. Use tools like the Anticholinergic Cognitive Burden Scale to identify risky drugs, then reduce or replace them under medical supervision. Here's what I want you to do this week. If someone you love is living with dementia, check their medication list. If any of these 6 drugs are on it, don't panic, but don't ignore it either. Bring the list to their doctor. Ask for a medication review. Many of these drugs can be replaced with safer alternatives, and if this video helped you connect the dots, share it with someone who needs to hear it. Because the next person who watches this might be the one who finally gets the answer they've been searching for.